Hello and welcome from Crown Point Optometry to our talk about laser eye surgery and other surgical options for correcting vision. So various ways of doing laser correction have been around for quite some time. But the good news is there's more options now than ever before. So we'll talk a little bit about who's a candidate and what kinds of things are useful for, and a little bit about the risks and the benefits. So first of all, I'll talk about the different types of surgery that are possible. So the first one is LASIK, which is the most commonly known one. So it is good mostly for nearsightedness, so for people who need their glasses for distance and tend to be okay for up close. It's also best for people who don't yet need reading glasses because it provides distance correction but doesn't provide near correction. Also, generally, the eye needs to be quite healthy and also general good health in order to promote optimal healing to get the best results. So again, it's a great option for people who do a lot of sports or camping, or people who, military or firefighters, or other times when, not needing to pull on a pair of glasses is a huge benefit. Another type of surgery involves implantable lenses. The advantage of that is that there's no limits to how high or low the power needs to be in it, so that tends to be a great option for people who have very, very high prescriptions. It is a little bit more of an invasive procedure, but it does expand the scope of who's able to get the procedures. These would be for people who, for example, are so nearsighted that they have to bring things up almost right at their face before they see it. So another option, which is fairly recent, is called clear lens extraction. So this, instead of doing the front of the eye, it actually involves the lens of the eye, and it's the same procedure that you would have if you had a cataract surgery, except obviously without the cataract being present. So it involves removing the lens of the eye and then replacing it with an artificial lens of the correct power. One of the great advantages of this is that even in the past 3 years, options for multifocal lens implants have gone up tremendously. So those are lens implants that will give good vision for both distance and far away. So those are good for people with pretty much any prescription, and it tends to be for people who already need some form of reading glasses. And one of its main benefits, it means you're never going to have to go through cataract surgery because the lens has been removed. So those are kind of the different options. And benefits are obviously that you can get a much better correction without glasses. So a little bit about the risks. So the main risks for conventional LASIK would be things like dry eye, glare, halos. The good news is, for people who don't have pre-existing problems with dry eye, the dry eye from the surgery tends to be quite temporary, within weeks to months at most, as well as glare and halos. But again, for people who have severe dry eye to begin with, then any form of LASIK is probably not the best choice. For the implant procedures, the main risks are things like retinal detachment and things like that, which again is a very serious risk. But the good news is there's ways of testing and kind of selecting to make sure that you're not at a particularly high risk for that. So yeah, so that's a little bit about the risks and benefits and the different types of laser procedures and other refractive procedures available. If you have any more questions, feel free to to book an appointment in our clinic. Thank you very much for watching.